what does quality healthcare mean to you?
To me, quality healthcare really always means leading with a servant's heart. And the reason I say that is because, like you just said, Rob, a lot of times it's personal. And if we can just be there to serve others and meet the patient where they're at, we're always going to be keeping the patient's best interest in mind. And that should be the point. So, if you treat them like your family, they pick up on that very quickly. And from a pharmacist perspective, what this means to me to deliver quality healthcare as a pharmacist is that you're delivering the right medication to the right patient at the right time, but only if medication is necessary or required, and it isn't always required. Quality healthcare, as the term suggests, really should be quality over quantity, and it should also focus on getting people healthy rather than keeping them sick. And for whatever reason, this seems to be a very novel idea in the modern healthcare system. So for that reason, I think our health system appears to be very broken in some aspects, broken in such a way that there's a lack of communication between hospitals and pharmacies, outpatient centers, insurance companies, in a way that it keeps the whole system very muddy for the patient, difficult to understand. It doesn't appear to be streamlined or simple. And because of that, patients tend to fall through the gaps, and they feel that, and then they fall off of their healthcare treatment regimen and they're not compliant. And for that reason, they don't reach their healthcare goals. So their treatment generally becomes very segregated because it's happening in several different places at once. So quality healthcare is really about bridging those gaps and providing the best possible experience for the patient, because it is an experience, it's a journey. Healthcare is a journey. It's not the same every day. And if we can help patients reach their individual healthcare goals, then I believe that we're actually delivering quality care. And this is why the area of functional medicine is so effective, especially when there's not a lot of communication, because it's an integrative practice. You're looking at everything. And just like I said, when I was seen by a functional medicine practitioner, she was looking at everything. She was looking at my whole body, the whole picture. And this is what helps to bridge those gaps. But true functional medicine is about also finding what the underlying root cause is of the illness. But it requires a whole team of healthcare professionals. It's not just the pharmacist, it's the physician, it's the nutritionist, it's everybody, right? But they have to be willing to listen and to empower and to encourage and to care enough to dig beyond what seems like it's obvious, what generally happens in that 15 appointment window. And patients deserve more time than that. Patients deserve to be held accountable and to have an adequate support system, which they don't always have at home. That might come from a pharmacist, it might come from a physician. But functional medicine is not about overloading people with medications that only offer a temporary fix. It's about replacing what you're deficient in. Because it's important to recognize people don't get sick because they have a low level of pharmaceutical drugs in their blood. They get sick because they're deficient in something or their body is out of balance. And so as a compounding pharmacist, once the doctor identifies what that root cause is, we can customize the medication for the patient if a medication is necessary, and we can replace it in the dose that's appropriate for that patient. And when I say deficient in something, I mean the most common one could be hormones, it could be vitamins, nutrients, antioxidants, enzymes, anything like that. But it's different than traditional treatment, because traditional treatment aims at covering up the symptoms or masking them with yet another medication. But in functional medicine and compounding pharmacy, we aim to replenish what the body's deficient in. So this is restoring both health and wellness. And Rob, when it comes to medications, the reason quality is so important is that the quality of the medications that you put in your body directly affects the way you feel, right? It's just like the food that you choose to put in your body. So I think that quality healthcare really is a commitment to complete health and wellness all around.